stop and say, hey, what's going on with me? Maybe I need to speak to someone about these things that are making me behave like this.
Thank you so much. So let's talk about reporting and resilience. So there was a study that was conducted by the Reuters Institute for the Study of Journalism, and they published some early data in June. So they surveyed about 73 journalists from international news organizations in June, and they said about 70% say they were suffering from psychological distress. More than a quarter of the respondents demonstrated symptoms like worry, feeling on the edge, insomnia, poor concentration, and fatigue. So this is a meeting, it's a congregation of editors. Maybe Professor Luka, you could tell us how, as editors, as leaders in our newsrooms, how we can support the younger journalists and the reporters who are being sent out in the field, and some of them are actually showing signs of post-traumatic stress disorder. They're meeting people who have suffered the impact of coronavirus. On the other hand, they're anticipating loss, like you said, job losses. They have to make through life and support their families with a fraction of their salaries. So how can we as editors support those who work for us in these difficult times?
Yeah, thank you very much. And I, of course, there are many ways of looking at this. One is that by the nature of the job of a journalist, you're going to be exposed to things that the average person doesn't get exposed to. You'll be exposed to people who are suffering extreme deprivation. You'll be exposed to people who are sick, people who have died, and all sorts of things. So this is the nature of the job, and I'm going to speak a little bit about preparation for that part of it. But then as for these changes that are happening because of COVID-19 and because of other social disruptions, obviously an employer who is able to cushion their employees, that would be a very good first step. If somebody is able to assure them that, listen, while we're going through these difficulties, we have certain things that we will do to support you so that you don't suffer unnecessarily, I think that would be useful. So, but talking about journalism and the stresses that come with the work that you do because of how the things you're exposed to, the organized helpers or first responders, as we call them, have a system that helps them to deal with the things that they're exposed to. And this system involves a number of things. One, you prepare in advance. So you as leaders, when you're sending out these young journalists to the field, it will be important for you to have a session which is organized, where you talk about the things that they're expecting when they go out there, and some of the effects of those things on their mental well-being. For instance, you're sending them to a place where people are fighting, police are intervening, and so on. You need to prepare that some people might get shot while you're there. You might see people dying. You might see people getting injured, and so on. And it might make you feel distressed. And that if you get to a point where you're feeling overwhelmed, these are the things you need to do. You can withdraw from the place, let a colleague continue, go find a quiet place, and just reflect. So preparation is an important thing. Then as they go out, not sending them out alone. So what we have learned with these kinds of interventions is that we send people in teams. So you might have at least 2 people working together so that they support each other, but then one person would notice if the other person is starting to break, and then they would provide support, get them out, get them to a safe place. So having a buddy system where you're watching over each other is a second intervention that is very important. After going out and seeing the things that they have seen, the third thing that is very important is having another formal session to debrief, where after you've filed your story, you have done everything, you have a forum where you'd sit with your fellow reporters, fellow journalists, and discuss what you went through today, what you saw today, how it made you feel, and then how you dealt with those feelings. And if people are sharing this around a table, then you'll find that people are able to say, aha, I feel validated. What I was feeling is normal, and how I dealt with, I can do it better going forward. So it is important for you to have at least these 3 things: preparation, and then the buddy system when somebody's out there in the field, and at the end of the day, having a debrief where people can share their experiences and how they handle the difficulties. That is very important in that setting. Outside of the daily experiences and so on, as editors, as managers of teams, it is important for you to have regular scheduled meetings where you go through your work-related stuff, but also you check up on each other. And in these days when we are doing virtual reporting, people are working from home, quote unquote, it is still important to have sessions where you talk with each other and find out, how are you doing? Okay, away from work, away from the reporting and so on, how are you doing as a person? So I think those are some of the tips that I would use to support the young ones as they go out, and to support even yourselves and your own colleagues.
Okay, thanks, Prof. And I think you've spoken to what Kwamshetsi had initially asked that you speak on. How, as a journalist, if I witness some of these things, how do I cope once I'm back in the newsroom? And I think Ken Busire is asking, how infectious is mental health? Is it something that I can pick from a colleague or something? So you can also address that.
Yeah, I think I like that he put infectious in quotes, because yes, it has broader meaning than that of having an traditional infectious agent infecting somebody and then this person passing it on. So mental ill health, traditionally in the usual sense of the word infectious, is not infectious. In other words, you can have a mental illness and the people around you do not develop a mental illness. However, a person with mental illness affects people around them in different ways. So if you have loved ones around you and you have a mental illness, they will definitely be affected one way or another. They will definitely experience some stress. And it is how they handle that stress that determines how their own mental health is going to be. So if they are also vulnerable to mental illness, and often they are if they're related to you, then the distress that comes with having and taking care of a relative with a chronic mental illness can also trigger mental illness in their relative or a close loved one. So that is the sense in which you could talk about infectious in quotes. If you have a very close colleague and they suffer a mental breakdown, and you have to be involved in helping them, and you do not have the resources to support them because you don't either have the knowledge, you don't know where to take them, you don't know how to support them, that can cause distress in you, and you might actually need to find somebody to support you to deal with that. So in that sense, you could argue about infectiousness, but not in the traditional sense of the word.
Thank you, Prof. So we have a question here from Kwamboka Evelyn, and she's asking, is it dangerous to take chamomile tea every day as a sleep inducer? I know many people during this pandemic, and even generally, we struggle with sleeping, or sometimes you manage to sleep, but you don't really rest, and you wake up very tired. So many of us would, go to chamomile tea as a sleep inducer. What are your thoughts on that?
My thoughts are that firstly, the way the human and perhaps all animals are made is that there's a period of wakefulness and there's a period of sleep. And under normal circumstances, you shouldn't need to take anything in order for you to sleep. You should be able to do your work and do your normal activities during the period of wakefulness. And then during the period of sleep, you should be able to feel sleepy, get to bed, sleep until you are no longer sleepy, then you wake up and go to your work. So that is the natural order of things. Obviously, due to work, due to other things, this is not happening. And so for me, I would say it is important for you to structure your day so that there is a defined time when you'll say, I am going to bed, and you will sleep. And there's a defined time when you'd say, I will wake up and work, and so on. If you're having difficulty getting sufficient restful sleep for several days in a row, and it is causing you difficulties, perhaps it is time to speak to a professional about what it is that is causing those problems. So if you find that you need to take something every day, whatever it is, in order for you to get to sleep, it might be useful to speak to a professional about the origin of your sleeplessness, the thing that is causing you not to sleep. We need to handle that so that you don't need to take something in order to sleep.
Great insights, Prof. Now, Elias Makori and Ruth Nesoba are asking something that we silently discuss but not openly. The pressure from the society for journalists and editors to try and lead a lifestyle similar to that of news sources. How would you advise that we deal with that? That if, let's say, I'm a business journalist and I hang around CEOs, then I want to behave and lead a lifestyle similar to theirs, while my financial ability cannot sustain it. How should journalists deal with that? Because the pressure most of the time comes from the society. So how would you advise that we deal with this?
Thank you very much. And I think it's not only journalists, people who are in positions that deal with other people in society. And we know that our society is structured such that there are people who are wealthier than others, and there are people who are doing much better than others, and we have to interact with them in line of duty. So I think one way of dealing with this situation is, again, preparation. When you have these young journalists that you're taking on board, having conversations around the fact that this is a job. This is a job you're doing. And this job will involve you interacting with people in all social strata. And you should try and separate your total identity from your job. Your job should not define who you are as a person. So when you're going to work, you should go to work and say, I'm going to interview so-and-so as my job. And when you interview them, you know I'm doing my job, you do your job well. When you're done, you file your story and you finish, you go back to your life as an individual. So one of the problems is tying your entire identity into your job. And this is common, I think, with the journalists who do the more front-facing work, like the reporters, news anchors, and so on. The pressure to look a certain way, to feel a certain way, is huge. It is important to have these discussions before somebody gets there, so that they know that what I am doing is an important job. It's something that must be done by someone. I am the one who is doing it now, but that doesn't define who I am. And I don't have to be tied up into an identity that involves that job. So it is very important. I know that for those of us in mental health, we actually do get preparation to think about the client and to think about ourselves, and not to tie our own identity into the relationship we have with the client. So it remains a therapeutic relationship. I think you need something similar in media, where you have a journalistic relationship with your sources that then doesn't entangle with your own identity as an individual. So maybe that is something that you as editors and media trainers, we can start discussing, maybe building that into your training, into your codes of ethics and so on, so that a person knows that I am not necessarily going to be the same as the sources that I am interviewing.
Thank you, Prof, for those insights. So let's talk about mainstreaming mental health agenda in our newsrooms and in our news media organizations. So, and this is an issue that has been brought up by Mary Daraja and Nancy Agutu. Mary is asking, could this be the right opportunity to put in place trauma programs for journalists? And Nancy is also talking about something that I'm sure, Professor Lukwa, you have witnessed this in your profession, about this stigmatization. So she says, Nancy says that some journalists who have mental health issues have been dismissed from work, and this makes those who have other similar issues shy away from reporting. You sort of hide it because you don't want to be branded as crazy. So what are your thoughts on that?
Yeah, so trauma programs in the workplace, in the newsroom, calling it trauma programs might make people think the only person who uses them should be somebody who has experienced trauma and so on. So it becomes a little bit more, I look at it as jargony, if you like. I would support every news organization having some mental health support program of some kind, so that somebody knows when I'm feeling a little overwhelmed, there's a place I will go to and speak to someone confidentially and be able, to recharge and get back to my usual self and go back to work without this reflecting on my record that I'm the one who uses this service, without reflecting on my record that I said that I'm being stressed by my editor, and so on and so forth. So a structured program at the workplace, some people call them employee assistance programs, if you like, is very important, especially for journalists because of the kinds of things that they go through. So it will be a place where somebody who has witnessed a death, for instance, can go and say, listen, I saw this happening. It has caused me so much stress. I am not sleeping. And then, they get a professional who listens and who supports them through dealing with those feelings. So I think it is time. If a media house does not have this, let us have discussions around how can you set it up. I mean, some media houses or some employers might think it will take huge amounts of money for us to set this up. Not necessarily. It can even be a linkage to a service provider that is used occasionally or something like that. But you need an arrangement that allows your workers to go to a place and unwind and remove this stress that is affecting them. For journalists who are being dismissed because of mental illness, this is a societal problem. Our society looks at mental illness as a weakness. They look at it as an inability to control your life, as an inability to control yourself. But really, this is not the case. I mean, hypertension, people get hypertension, and if they don't know that they have it, eventually it can cause very serious complications, including stroke, and it can even kill you. But when somebody says, I have hypertension, we don't dismiss them from work. We actually link them with our health providers, and they get help, and they come back to work and continue working. And sometimes we might even ask them when they say, hey, I have a headache, but are you taking your hypertension pills? This should be the same with mental health. If somebody has depression, they can go get professional help, they get treatment, and they come back to work and they will continue working. I will put it to you that, in fact, many people who eventually develop mental illness are among the most creative people that you can work with. And that creativity, sometimes with mild symptoms of mental illness, there's an elevated creativity. You want these people in your space. You want these people to challenge the work environment so that you do better. And it might be useful for you to get them help and get them back to work for that reason. I think there's a lot to be done in destigmatizing mental illness. There's a lot to be done. And you in media, I think, would play the central role. I know that when you do these surveys out there, the media is among the most trusted institutions in many of our countries. And if you take on this, but start by working on yourselves so that you know the truth about mental health, you know the right messaging, and you can model the right attitudes, and then you can take it out there and help influence other workplaces as well.
Okay, great, Prof. There's a request that you switch on your video when you are responding to these issues, at least so that people can appreciate. Franklin Wambugo is asking that in the face of all these job losses, especially for the young journalists, how do you help them in refocusing, just to find out how to move on after a job loss? Let's say you were 2-3 years in a job, and unfortunately, the company or the organization has decided to terminate your services. How do you recommend that these young journalists cope? And Mashera Gaido is asking 2 questions that I want to link. One, how do you suggest that the Editors Guild sets up a support program for mental health for its membership and journalists as a whole? And also asking that we live with people who undergo this mental health. What are some of the obvious signs that you are able to pick and know that the person, my sister, my brother, my son, my daughter, or my dad, or my mom, is at a tipping point? If you could just tackle.
Okay. Very well. I think the practical tips for young journalists, how they can pick up, I think one of the things that I find is maintaining that positive attitude and looking at this job loss, perhaps, as some people say, that when one door closes, another one opens. trying to refocus and look at it as an opportunity to do something, maybe something that you're good at, but that you've been postponing. I've seen one young journalist who, I don't know if he was dismissed or he lost his job, but then I've seen that he went and started something like a law practice, something totally innovative, even though he hasn't finished Kenya School of Law, and there was a bit of discussion around that. But those are the kinds of things that I would be asking the young journalists to focus on, to know that there's a lot more time ahead of them than behind them, and that they have, in fact, as a journalist, you are multi-talented in my view, because you have interacted with so many people in many fields. You should take advantage of the knowledge you have gained as you do your job to see if you can start something new. But it is easier said than done, and I always have to put the caveat that it is easier said than done. It is very individual. All these things are very personal, and it hits some people harder than it hits others. And the advice should always be tailored towards that person's peculiar circumstances, their skill set, and their abilities to pick up the pieces and move on. If your job loss involves getting some amount of money, thinking about how to invest that money so that it pushes you for a while as you find your footing would be advice that these young people might benefit from as well. On the question about what the Editors Guild can do to establish a support program for members, I think there is room for us to discuss this. We can see how to provide support for you to have a program. There are organizations that provide psychological support services for individuals and for groups. And I think it is possible for us to link you up so that you see what is possible and what is needed for your members. So it is something that is useful. So when I was Vice President of Kenya Medical Association, we actually set up a physician wellness program. Again, we sought out the professionals and then set up a program that when a doctor is not well, they can be referred or they can find help from these support services. And the same structure can apply to almost any organization or any association where you set up a system, initially a buddy system where you can say, we have noticed so-and-so is not doing so well, but he's not seeking help. So somebody can speak to him about the availability of help. And if he refuses or doesn't want to get it, then thinking through mechanisms of using his social support system to guide him gently towards help. There are things that we can talk about. About colleagues, family, and neighbors who are facing mental health issues, danger signs. As I said in the presentation, and some of those things are in the presentation that will be shared, if you've known somebody for a while and you know that they behave a certain way and that they usually talk a certain way and they do things a certain way, and then you start noticing changes in how they're doing those things, how they're speaking, how they're interacting, it is useful for you to get a little bit concerned, get in touch with them, ask them if everything is okay. Usually everything is not okay. And perhaps start pointing them in the direction of help to say, I know somebody you can talk to. Even if you don't want to talk to me, there's somebody you can talk to. And if you're okay, that person will tell you you're okay. And if you're not okay and there's a problem, that person can help you, point you in the direction of help. So when things are changing in people that you know, for me, that is the clearest danger sign. For many mental illnesses, one of the clearest pointers to a problem are sleep problems. So somebody whose sleep pattern changes suddenly, somebody who was used to sleep at 10 and wake up at 6, starts sleeping at 3 and waking up at 6, or not sleeping at all, you might want to say, hey, I'm noticing that your social media activity at 2 a.m. is increasing, and you never used to be a night person. What's going on? So stuff like that. Just pointing out these things might be an opportunity for somebody to start talking about the challenges that they're going through, and might be an opportunity to point them in the direction of help.
Thank you, Professor Lukoi. I like what you advised young journalists, like my friend likes to say, you have more future than past. Yeah. So there's another question here from Masharia Gaido. For those of us who are unable to afford expensive consultants, we live in a country where I think consultation fee for a typical psychiatrist, I don't know, 3,500 to even 4,500. For those who cannot afford such expensive consultants, what interventions are available, given that Madari Mental Hospital might not look like a very appealing option? I mean, when you disappear for a couple of months and you tell your colleagues that you're in Madari, I don't think that would, augur very well with many people. So what options are there?
Okay, so firstly, I'm going to, for the rest of my professional life, I'm going to be devoting it to changing what we think about Madari Hospital. I'm hoping that when I'm done, everybody will be clamoring for an opportunity to be seen at Madari Hospital, because that is something we need to work on. It shouldn't be that if I say I spent a week at Madari Hospital, people start getting scared of me. It should be that if I say I spent some time at Madari Hospital, people will be very happy that I am now well enough to interact and to do the things that I need to do. I agree that the services have been expensive. These mental health consultations are very expensive, and the reason is that there are few specialists in the field. What we are doing now is that, in fact, we have trained people whom you can talk about as primary mental health care providers. We have trained medical psychologists. We have trained some clinical psychologists. We have trained, cadres of people who can provide some of these services when you need them, without necessarily getting to a point where you need to see a psychiatrist, for instance. And the majority of people will need those services when symptoms are still early. And it will prevent, if you see these people, then it prevents the need for you to see a psychiatrist, where you might have to pay a lot of money. So those are some of the moves. And I've seen government is employing these psychologists and other middle cadre mental health workers. So let's take advantage of that. Let's use them. And they're not as expensive as seeing a high-level clinical psychologist or a psychiatrist. Having said that, I think there are ways in which you'll find psychiatrists who charge all sorts of you can get a psychiatrist for 2,000 bob. If you went to KNH, there is a psychiatrist. I don't think you'd pay as much as if you went to see a private psychiatrist. Some of our county hospitals also have psychiatrists, and you could see them there, and it will not cost as much as if you went to a private one. Moi Teaching and Referral Hospital in Edinburgh, these big hospitals, you'll find that they have at least 1 or 2 psychiatrists where you can get the same service, the same quality of service, but at lower costs. For the private ones, as the way the system is set up is that we leave the pricing to the market, and people vote with their feet. Unfortunately, those that everybody wants to see, they will charge more, and so that's just the nature of the beast.
Okay, thanks, Prof, for that. And I think we don't have any more questions coming up, but there are comments. I see Josephine Karani saying that mental illness has stigma in our African setups, and not many people will come forth to admit they need help. The close circle of family and friends must be the first ones to support. And Jackson Karanja from Nakuru saying something that is very alive to the industry today, saying that their chapter desk in Nakuru has received several concerns from journalists on mental concerns. So I think this is something most of us here as team leads really need to take seriously and just find a way of ensuring that we help our colleagues cope with it. And I think also on the issue of where somebody can get the help, I know today a number of insurance firms, NHIF I think included, have got that component that you can walk in and see a consultant and it will be covered by the insurance firm. So I think those are some of the things that we can explore and also work with our HR departments just to espouse them to our members so that they are aware, so that people do not suffer in silence. Ruth saying that Prof, would you push for a virtual therapy option and see if there are members of KMA, that is the Kenya Medical Association, who can offer services pro bono, whether it's through a local hospital or an app that would benefit journalists who, as you know, are poorly remunerated? I think Ruth is speaking for all of us.
Okay. So in this COVID-19 period, there have been innovations that have provided exactly what Ruth is asking for. I forget, but there's a hotline. I think the number is 1199, if I'm not wrong, that if somebody called, they would be able to speak to a mental health worker and they wouldn't have to pay for that service at this time. So that is available. And I know that the Ministry of Health is also setting up a virtual mental health service that is just almost due to be launched. I've spoken to the people at the ministry in the past couple of days, and they're almost ready to launch it. There will be a toll-free line that a person can call and speak to a mental health worker and explain their problem and then be provided with the assistance they need, if it can be provided virtually or linked to care out there in person. So these services are there. And I know because of the fact that they're in their infancy, there will be a few hiccups here and there, but we are going to learn from this and design them so that they meet the needs of everybody who comes there, whether they're journalists or members of the public. Yeah.
Thank you so much, Prof. I don't think there's any question that we have left unanswered or any comment that we have not talked about. At this point, I'd like to invite Kwamboka Evelyn, the chair of the Innovation Committee, for 1 or 2 remarks to just give us a background and introduction to this webinar series. Evelyn? Evelyn, kindly unmute. Please unmute, Evelyn.
Can you hear me?
Yes, we can.
Thanks so much, Njoki. Prof, asante sana for the talk. We've learned a lot, and I know it's going to help most of our members, especially in the day-to-day operations. Now, with the COVID-19 pandemic that has seen associations resort to virtual meetings in serving members, KEG has organized a series of psychological support webinars for the year 2020. We will have experts speak to members in one webinar per month on topics such as health, finance, leadership, and solutions in journalism. These specialized engagements will go a long way in equipping journalists with the right tools to discharge their duties during this unique time of COVID. I know we've picked a lot from professors' talk today, and yes, we will make use of it. Now I've known what chamomile does. Asante. I now welcome Rosalia. Rosalie?
Thank you, Evelyn. And thank you so much, Professor Lukoye Atwoli, for the illuminating presentation. And we hope to invite you again at a different time to continue with that discussion, because it can never end in one session. And thank you so much for accepting our invite. And we also want to thank all the members of Kenya Editors Guild for sparing the time on a Saturday morning, on a busy Saturday morning, to attend this webinar. And I am going by the comments that have come through and by the suggestions from members. I believe that it's been worth the time this morning. And thank you also, Prof, for giving us the suggestion and for giving us the invite that we can work together to support mental health programs for journalists. The comment that was made by Masharia Gaida, and we will take it up from here. We will reach out to you again so that we can see how that works for the benefit of journalists. Thank you also for just giving us tips about reality, that yes, we can mingle with the news sources, but we are not the sources. We are not, we should lead our lives the way we should lead our lives. So thank you so much for that. And without much further ado, I think we are done with the meeting. And thank you all also. Not only KEG members were in this meeting, there were also other friends, other journalists, and I really hope you've learned a lot, and we hope to invite you again. The next series next month will announce the topic in due course. All right, so I hand you back over to Evelyn for closure. Evelyn Chege.
Yes, that's me. For those who don't know. Thank you so much for attending. We will be taking suggestions on topics that you would like us to tackle and speakers that you'd like to hear from. So from me and my colleague Bonyo, it's goodbye and have a blessed weekend.
Thank you very much.
Bye. Yeah, thank you so much.
Cross on.
Thank you.